Kidney disease is the 8th leading cause of death in the United States. An estimated 31 million people in the United States have chronic kidney disease, also known as CKD. Patients with CKD have two treatment options, a kidney transplant or dialysis. However, there are more than 90,000 people on the waiting list per year for a kidney transplant, so the chances of an individual receiving a transplant are very slim. Under those circumstances, most CKD patients must receive dialysis. There are two types of dialysis, hemodialysis and peritoneal dialysis. But what is hemodialysis?
Hemodialysis is one kind of dialysis which usually is performed in a center. And hemo means blood, so it's blood dialysis. A small amount of your blood is taken out of your body at one time and put through a filter and cleaned and put back in. And that's done over and over a period of 3 to 4 hours, usually 3 times a week. In order to get the blood, you have to have a way to access the bloodstream. And the most common way that's done is something in your arm under the skin, either something called a fistula.
And it does require placing needles into this access. 2 needles are required, one to take the blood out of the body so that it goes through the machine and through the filter, and then a needle to return the blood to the body after it's been cleansed.
With that in mind, what is peritoneal dialysis?
We have a membrane called the peritoneal membrane. It is a lining of our abdominal cavity, and fortunately we can use that peritoneal membrane as a filter.
And the peritoneal dialysis is where you have a catheter in your abdominal cavity and where you do something called an exchange, where you put some fluid in your belly, let it dwell for a little bit, and then you drain it out. And as you drain it out, that takes out all the waste products and some fluid along with it.
Well, there's 2 choices for peritoneal dialysis. There is the manual bag, in which you do an exchange 4 times a day, and then there is the night cycler method, of which when you're ready to go to bed, you hook up to the night cycler, and it does these exchanges for you automatically.
Although dialysis is not painful, patients endure these scars of needles entering their arms or abdomen as they must return for treatment at least 3 times per week. CKD significantly changes the lifestyle of those who have fallen victim to this disease. Patients must change their previous eating habits and be placed on a strict diet. Patients must also implement specific medication into their lives in order to function properly throughout their day.